Lacunar strokes are the silent killers of independence in adults over 60. These small strokes occurring deep within the brain affect over 25% of all stroke patients. Yet 95% of people have never heard of them or wouldn't recognize the warning signs if they experience them. Unlike dramatic large vessel strokes causing sudden complete paralysis on one side of the body, total loss of speech, or immediate collapse requiring emergency ambulance transport, lacunar strokes often cause subtle, seemingly minor symptoms that patients and even experienced doctors routinely dismiss as normal aging, fatigue from poor sleep, stress from life circumstances, or minor temporary problems not requiring emergency medical care or even a doctor's visit. By the time the pattern of repeated lacunar strokes is finally recognized months or years later during evaluation for progressive disability, significant irreversible brain damage has accumulated throughout critical deep brain structures controlling movement, sensation, cognition, balance, and vital functions. The window for prevention has closed. The damage is permanent. As board-certified stroke neurologists who have diagnosed and treated thousands of acute stroke patients and managed hundreds of chronic stroke survivors over 40 years of combined clinical practice, in major academic medical centers and community hospitals, we see the devastating long-term consequences of missed and unrecognized lacunar strokes weekly in our outpatient neurology clinics and inpatient hospital stroke units. Patients come to us after experiencing months or years of progressive cognitive decline that families initially dismissed as senior moments, progressive walking difficulty and balance problems that were attributed to arthritis or just getting older, urinary urgency and incontinence that were blamed on prostate problems or weak bladder, or personality changes including apathy and social withdrawal that seem like depression or natural aging. We perform comprehensive neurological examinations. We order brain MRI scans with specialized sequences including diffusion-weighted imaging, FLAIR sequences, and gradient echo imaging. The images reveal dozens, sometimes hundreds, of small lacunar infarcts scattered throughout the deep brain structures, including basal ganglia controlling movement initiation and coordination. Thalamus serving as the brain's sensory relay station, internal capsule where motor and sensory nerve fibers are tightly packed together, and subcortical white matter containing the communication cables connecting different brain regions. Each tiny stroke measuring only a few millimeters in diameter destroyed a small focused area of brain tissue. Individually, each single stroke seemed clinically insignificant at the time it occurred, perhaps causing no noticeable symptoms whatsoever, or only fleeting symptoms lasting minutes that were dismissed and forgotten. Collectively, the cumulative burden of dozens or hundreds of these small strokes has caused massive total brain damage leading to vascular dementia with profound memory and thinking problems, severe Parkinsonian gait disorder requiring walkers or wheelchairs for mobility, recurrent falls resulting in hip fractures and head trauma, urinary incontinence requiring adult diapers, and complete loss of functional independence necessitating nursing home placement. What makes lacunar strokes particularly insidious, dangerous, and tragically underrecognized is that approximately 70 to 80% are completely clinically silent at the exact time they occur. You experience absolutely no obvious symptoms, no sudden paralysis, no speech problems, no visual loss, no dramatic warning signal that your brain has been injured and brain tissue has died. The stroke happens silently while you sleep peacefully through the night, while you watch television relaxing in your living room, or while you go about routine daily activities like preparing meals or doing household chores. You never know the stroke occurred. You feel completely normal. Yet deep within your brain, A small penetrating artery has become blocked by atherosclerotic plaque, lipoielinosis from years of uncontrolled high blood pressure, or a tiny embolus that traveled from your heart or carotid arteries, brain tissue downstream from the blockage deprived of oxygen and nutrients has died within minutes. A small permanent cavity or lacuna has formed in your brain. Over months to years, repeated silent lacunar strokes accumulate progressively. Each one adds to the total burden of brain damage. Eventually, the cumulative damage crosses a critical threshold where symptoms become noticeable to you or your family members. But by then, extensive irreversible damage throughout multiple brain regions has occurred. The opportunity for early intervention and prevention has been lost. Research published in the journal Stroke examined lacunar infarct prevalence in apparently healthy adults using population-based brain MRI screening studies. Studies found that 20 to 30% of apparently healthy adults over age 60, with absolutely no history of stroke or neurological symptoms, had lacunar infarcts visible on brain MRI imaging. These were completely unrecognized, clinically silent strokes that patients never knew they had experienced. The prevalence of silent lacunar infarcts increased dramatically and progressively with advancing age, affecting over 40% of adults over 80 years old and approaching 60% in adults over 90. Critically, people with lacunar infarcts detected on brain imaging, even when they had no current symptoms, had significantly higher risk of subsequent symptomatic strokes, including both additional lacunar strokes and large vessel strokes, progressive vascular dementia with devastating cognitive decline, physical disability affecting walking and self-care, and premature death from cardiovascular causes. The silent strokes were not benign incidental findings. They were serious warning signs of advanced cerebrovascular disease requiring aggressive medical intervention to prevent progression to vascular dementia and permanent disability. Lacunar strokes occur when small penetrating arteries deep within the brain become progressively blocked and eventually completely occluded. These tiny arteries measuring only 2 to 0.8 millimeters in diameter, approximately the width of a few human hairs, branch directly off larger arteries at the base of the brain and penetrate deep into brain tissue to supply blood to deep structures. They supply critical areas including the basal ganglia, which coordinate movement and prevent tremor, the thalamus, which processes all sensory information, the internal capsule where motor nerves controlling the entire opposite side of the body travel in a tightly packed bundle, the pons in the brain stem controlling balance and coordination, and the subcortical white matter containing nerve fiber tracts connecting distant brain regions. When these penetrating arteries become blocked by atherosclerotic plaque accumulation from cholesterol deposits and inflammation, lipoielinosis, where chronic high blood pressure causes the arterial walls to thicken and the lumen to narrow, or microemboli, which are tiny blood clots or cholesterol fragments that travel from the heart or neck arteries and lodge in these small vessels. The small regions of brain tissue they supply are completely cut off from oxygen and nutrient delivery. Within minutes, brain cells in the affected region begin dying through a process called ischemic necrosis. Within hours, the affected brain tissue has completely died and liquefied, leaving behind a small fluid-filled cavity or lacuna, hence the name lacunar infarct. In this comprehensive video, we'll examine 7 critical warning signs of lacunar stroke that people over 60 experience regularly, but 95% overlook, dismiss, or attribute to other causes. Number 4 is a symptom so commonly and universally attributed to normal aging that 90% of patients experiencing it never seek medical evaluation, never mention it to their doctors, and never receive appropriate diagnostic brain imaging. Yet it indicates active ongoing lacunar stroke disease requiring immediate aggressive treatment to prevent progression to vascular dementia and permanent disability. Number 1 is the most sensitive early indicator of developing lacunar stroke disease, but is rarely recognized because symptoms are intermittent, mild, and completely resolved, leading both patients and doctors to assume nothing serious is happening. These aren't vague, nonspecific symptoms that could indicate dozens of different conditions. These are specific, highly recognizable patterns indicating small vessel cerebrovascular disease is actively and progressively damaging your brain tissue right now, today, at this very moment. Complete medical references for all clinical studies and research papers mentioned in this video appear in the video description below. Understanding these warning signs allows early diagnosis through appropriate brain imaging and aggressive vascular risk factor management, including blood pressure control, cholesterol management, diabetes treatment, and antiplatelet therapy before irreversible brain damage accumulates to the point of dementia and disability. Now, let's examine in detail exactly what your brain is desperately trying to tell you when lacunar strokes begin silently developing. Warning sign number 7, sudden sharp stabbing pains in the foot or hand accompanied by burning sensations. Starting at number 7, perfectly aligned with the dramatic imagery shown in the thumbnail of this video depicting intense pain and electrical sensations in the foot, is a lacunar stroke syndrome that manifests as sudden sharp stabbing pains, burning sensations, or electric shock, like feelings in one foot, hand, or an entire side of the body. This particular presentation is called pure sensory stroke or thalamic pain syndrome, and it indicates lacunar infarction specifically in the thalamus, your brain's primary sensory processing center. Located deep in the brain's core, the thalamus is a paired structure, meaning you have one thalamus on the left side of your brain and one on the right side. Each thalamus serves as the relay station for all sensory information traveling from the opposite side of your body to the cerebral cortex, where conscious sensation is perceived and interpreted. Touch, pain, temperature, vibration, and position sense all travel through the thalamus before reaching conscious awareness. When a lacunar stroke damages specific nuclei within the thalamus, particularly the ventroposterior lateral nucleus or ventroposterior medial nucleus, the result is abnormal pain and sensory disturbances in specific body regions corresponding to the damaged area. The pain and sensory symptoms from thalamic lacunar strokes are distinctive and unlike pain from other causes. Patients describe sudden onset of intense burning pain, often compared to touching a hot stove or having the affected body part on fire. Sharp stabbing pains, like being stuck with needles or ice picks, occur spontaneously without any trigger. Electric shock sensations shoot through the affected area randomly. Some patients describe crawling sensations under the skin or feeling like insects are walking on them, a symptom called formication. The affected area may feel exquisitely hypersensitive, where even light touch from clothing or bed sheets causes severe pain, a phenomenon called allodynia. Alternatively, the area may feel completely numb and dead, yet paradoxically painful at the same time. What makes these sensory symptoms particularly characteristic of thalamic lacunar stroke is their distribution and timing. The pain and abnormal sensations typically affect one entire side of the body, including the face, arm, and leg on the same side. The symptoms develop suddenly, reaching maximum intensity within minutes to hours. Unlike gradual progressive neuropathy pain that worsens slowly over months, the thalamic stroke pain appears abruptly. The pain is constant rather than intermittent, persisting 24 hours daily, though it may fluctuate in intensity. Research published in the journal Pain examined characteristics of central post-stroke pain, also called thalamic pain syndrome. Studies found that 8 to 12% of all stroke patients developed chronic central pain, with thalamic lacunar strokes being the most common cause. The pain typically began days to weeks after the acute stroke, though some patients experienced pain immediately. The pain was often severe and disabling, described as the worst pain patients had ever experienced, worse than childbirth, kidney stones, or any previous injury. Standard pain medications, including opioids, provided minimal relief, while medications specifically targeting nerve pain, including gabapentin, pregabalin, amitriptyline, and duloxetine, provided modest benefit in only 30 to 50% of patients. What you absolutely must do if you experience sudden onset of severe burning pain, electric shock sensations, or other unusual sensory disturbances in your foot, hand, or one side of your body is seek immediate emergency medical evaluation. Do not assume this is peripheral neuropathy, a pinched nerve, vitamin B12 deficiency, or diabetic nerve damage. While those conditions can cause pain and sensory symptoms, they develop gradually over months to years, not suddenly over minutes to hours. Call 911 or have someone drive you immediately to an emergency room. Emergency physicians will perform rapid neurological examination, testing sensation, strength, coordination, and other functions. Brain imaging with CT scan, or preferably MRI with diffusion-weighted imaging, will be performed emergently to identify acute stroke. If thalamic lacunar stroke is confirmed, treatment focuses on preventing additional strokes through aggressive management of vascular risk factors and providing appropriate pain management. The foot pain depicted so dramatically in the thumbnail image with electrical lightning bolts is not just a metaphor. Patients with thalamic stroke literally feel like electricity is shooting through their foot or hand. They describe the pain as burning fire that never stops. This is your brain's thalamus damaged by stroke, sending completely aberrant pain signals that your cortex interprets as severe burning and electric sensations, even though no actual tissue damage exists in your foot or hand. The problem is in your brain, not in your extremity. Warning sign number 6. Severe abdominal or flank pain that comes in waves mimicking kidney stones or appendicitis. Warning sign number 6, also prominently featured in the thumbnail showing the abdominal and flank region highlighted, involves severe abdominal pain, flank pain radiating to the back, or pain in the kidney area that appears suddenly and causes patients to rush to emergency rooms thinking they have kidney stones, appendicitis, gallbladder attack, or other acute abdominal emergency. This surprising manifestation of lacunar stroke occurs when the stroke affects the thalamic regions or other sensory pathways that process visceral pain signals from internal organs. The mechanism is similar to the foot pain described in warning sign 7, but involves sensory pathways processing pain from abdominal and pelvic organs rather than from skin and extremities. When lacunar stroke damages specific thalamic nuclei or brain stem structures processing visceral sensation, the damaged brain regions send aberrant pain signals that are perceived as severe pain in the abdomen, flanks, pelvis, or chest despite no actual pathology in those organs. Patients describe sudden onset of severe cramping abdominal pain, sharp stabbing pains in the right or left flank area where kidneys are located, or deep aching pain in the pelvis. The pain may come in waves similar to kidney stone pain. It may be accompanied by nausea and vomiting. Patients often present to emergency rooms convinced they have appendicitis, kidney infection, kidney stones, ovarian cyst rupture in women, or other acute abdominal emergency requiring surgery. Emergency physicians perform extensive workup including blood tests, urinalysis, CT scans of the abdomen and pelvis looking for kidney stones or appendicitis, and sometimes ultrasound imaging. All tests come back completely normal. No kidney stones, no appendicitis, no gallstones, no ovarian cysts, no explanation for the severe pain. The patient is often dismissed as having unclear abdominal pain or possibly anxiety. Pain medications are prescribed and the patient is sent home. What's missed is that the pain is neurological in origin, caused by lacunar stroke, affecting sensory processing pathways in the brain. Unless emergency physicians specifically consider this possibility and order brain MRI imaging, the stroke goes undiagnosed. The patient continues having pain that doesn't respond well to usual treatments because the problem isn't in the abdomen, it's in the brain. Research examining unusual presentations of stroke found that referred visceral pain from thalamic and brain stem strokes occurred in 2 to 3% of lacunar stroke patients, but was almost universally missed initially because patients and physicians focused on the painful body region rather than considering central nervous system pathology. Many patients underwent unnecessary abdominal surgeries before stroke was finally diagnosed. What you must do if you experience severe sudden abdominal or flank pain is absolutely seek emergency evaluation to rule out dangerous conditions like appendicitis or kidney stones that require urgent treatment. However, if extensive testing shows no explanation for your pain, insist on neurological evaluation and brain imaging. Abdominal pain from thalamic stroke requires treatment focused on the brain, not the abdomen. Vascular risk factor management and neuropathic pain medications are appropriate treatments. Warning sign number 5. Episodes of sudden weakness or clumsiness in one hand or leg lasting minutes to hours. Warning sign number 5 is the classic lacunar stroke syndrome called pure motor stroke or motor hemiparesis. This presents as sudden weakness affecting only the face and arm, only the arm and leg, or only the leg on one side of the body. Unlike massive cortical strokes causing dense complete paralysis of the entire side of the body, lacunar strokes typically cause mild to moderate weakness in a limited distribution because only a small focused area of the motor pathway deep in the brain is damaged rather than large areas of motor cortex. The weakness develops suddenly over minutes, often described as the affected limb feeling heavy, clumsy, awkward, or not responding to commands normally. You might notice difficulty buttoning clothes or manipulating small objects with one hand. You might drop objects repeatedly from the weak hand. One leg might feel heavy or drag slightly while walking, causing you to trip or stumble. The weakness may last minutes to hours, sometimes resolving completely without treatment, leading patients to dismiss it as a cramp, muscle strain, or temporary problem, definitely not requiring an ambulance or emergency room visit. The mechanism involves lacunar infarction in the internal capsule, corona radiata, or basis ponti structures where motor nerve fibers traveling from the brain cortex down to the spinal cord. Control muscles are tightly packed together in a very small space. Each region of motor cortex controlling different body parts sends nerve fibers that converge together into these narrow bottleneck regions before diverging again. A tiny stroke measuring only a few millimeters in diameter in these critical bottleneck locations can affect motor fibers controlling specific body parts, for example, just the arm or just the face. and arm together without affecting adjacent motor fibers controlling other body regions. This produces the characteristic pattern where only certain body parts become weak, while adjacent areas remain completely normal strength. You might have significant arm weakness, but completely normal leg strength, or severe leg weakness with normal arm strength. This limited distribution is characteristic of lacunar stroke, affecting small, deep structures, quite different from cortical strokes affecting large areas of motor cortex causing weakness of. Entire side. Research from the journal Neurology examined clinical presentations and outcomes of pure motor lacunar strokes. Studies found that pure motor stroke accounted for 50 to 60% of all symptomatic lacunar strokes, making it the most common lacunar syndrome. The weakness was often relatively mild at onset, with patients retaining ability to move the affected limb, though with reduced strength and coordination. This mild presentation caused many patients to delay seeking medical care for hours or even days, assuming the weakness would resolve spontaneously or was just a muscle problem. Critically, studies found that 30 to 40% of patients experiencing pure motor stroke had experienced prior transient episodes of weakness in the same limb distribution in the preceding days to weeks. These were transient ischemic attacks, or TIA, temporary interruptions in blood flow lasting minutes without causing permanent brain damage. The TIA were warning signals that the small penetrating artery was becoming critically narrowed and that permanent stroke was imminent. Yet most patients experiencing these warning TIA did not seek medical attention until the permanent stroke occurred. What you absolutely must do if you experience any sudden weakness, even if relatively mild and even if it resolves quickly, is call 911 immediately and go to an emergency room. Don't wait to see if symptoms resolve. Don't drive yourself to the hospital. Call emergency services. Weakness indicates brain tissue is not receiving adequate blood flow right now. If symptoms persist for more than a few minutes, you're having an active stroke requiring emergency treatment within hours. If symptoms resolve completely within minutes, you've had a TIA, a final warning that major permanent stroke is imminent within hours to days without emergency intervention. Emergency physicians will perform rapid neurological examination and brain imaging with CT scan, initially to rule out brain hemorrhage, followed by MRI with diffusion-weighted imaging, which is much more sensitive for detecting small lacunar infarcts. Vascular imaging with CT angiography or Mr. Angiography evaluates the large arteries in the neck and brain. Treatment depends on the specific stroke mechanism identified, but may include clot busting treatment with intravenous TPA if you arrive within 4-5 hours of symptom onset, blood pressure management to prevent hemorrhagic transformation, antiplatelet or anticoagulation medications to prevent recurrent stroke, and aggressive risk factor control. Warning sign number 4, progressive difficulty with balance, walking, and frequent unexplained falls that family notices before you do. Warning sign number 4 is the most commonly overlooked and dismissed lacunar stroke symptom because it develops gradually and progressively rather than suddenly, and because it's almost universally attributed to normal aging, arthritis, leg weakness, inner ear problems, or general deconditioning from being less active. Progressive gait disorder and balance impairment from accumulating lacunar strokes in specific deep brain regions creates a characteristic clinical syndrome that 90% of affected patients never recognize as stroke-related. This syndrome, called vascular Parkinsonism, lower body Parkinsonism, or arteriosclerotic Parkinsonism in older medical literature, presents with progressively worsening difficulty initiating walking as if your feet are stuck to the floor when you try to start walking, shuffling gait with very short steps measuring only a few inches rather than normal stride length, difficulty making turns requiring multiple tiny steps to rotate your body 90 or 180 degrees, severely impaired balance causing you to wobble, catch yourself on furniture, and fall forward or backward frequently. Freezing episodes where your feet suddenly stop moving mid. Walk and you feel frozen in place, unable to take the next step, and an inability to walk and perform another task simultaneously, such as walking while talking or walking while carrying objects. Unlike classic idiopathic Parkinson's disease, which typically begins with tremor in one hand, causes significant rigidity and stiffness throughout the body, and affects upper body functions like facial expression and handwriting, early vascular Parkinsonism primarily and predominantly affects the lower body and walking ability. Tremor is usually absent. Hand coordination and facial expression remain relatively normal early in the disease. The walking difficulty is disproportionately severe compared to any upper body symptoms. The mechanism involves accumulating lacunar infarcts in the basal ganglia, particularly the putamen and globus pallidus, and extensive white matter disease in the subcortical paraventricular white matter connecting frontal lobes to basal ganglia. The basal ganglia are critical for initiating movement, maintaining posture, and coordinating the complex sequence of muscle activations required for smooth, fluid walking. When multiple small strokes damage basal ganglia circuits, movement initiation becomes impaired, causing difficulty starting to walk. Postural reflexes that automatically maintain balance become dysfunctional, causing falls. The smooth, automatic, rhythmic pattern of walking deteriorates into a shuffling, uncoordinated gait. Research published in the journal Movement Disorders examined vascular Parkinsonism, prevalence, and characteristics in older adults. Studies found that up to 30% of patients diagnosed clinically with Parkinsonism actually had vascular disease causing their symptoms rather than neurodegenerative Parkinson's disease. Brain MRI imaging revealed extensive lacunar infarcts and confluent white matter disease. The distribution of imaging abnormalities correlated with severity of gait impairment. Critically, vascular Parkinsonism patients did not respond to Parkinson's medications like levodopa or dopamine agonists because the underlying pathology was not dopamine deficiency, but rather structural brain damage from multiple small strokes. Treating these patients with high doses of Parkinson's medications caused significant side effects, including hallucinations, confusion, and low blood pressure without improving walking or balance. The correct treatment required addressing the underlying cerebrovascular disease, not replacing dopamine. What distinguishes vascular Parkinsonism from normal age-related walking changes or orthopedic problems like arthritis is the characteristic pattern. The walking difficulty is disproportionately severe compared to what would be expected from arthritis or muscle weakness alone. Patients may have relatively strong leg muscles on examination, but still shuffle and freeze when walking. The gait is distinctively slow, shuffling with tiny steps and poor balance. Turning in place requires many small steps and is often when patients lose balance and fall. These features occurring together in combination, particularly when accompanied by other symptoms on this list, strongly suggest underlying cerebrovascular disease rather than simple aging. What you must do if you or family members notice progressive walking and balance difficulty is seek comprehensive neurological evaluation rather than accepting it as inevitable aging that nothing can be done about. Brain MRI with flare and gradient echo sequences can detect lacunar infarcts and white matter disease that may be causing symptoms. If vascular Parkinsonism from lacunar stroke disease is diagnosed, aggressive vascular risk factor management can slow or sometimes halt further progression. Treatment includes blood pressure control to target less than 130 over 80 millimeters of mercury systolic and diastolic, which is absolutely critical as hypertension is the primary risk factor for lacunar strokes. Statin therapy for cholesterol management with LDL goal under 70 milligrams per deciliter in high-risk patients. Diabetes control with hemoglobin A1C maintained below 7%. Antiplatelet therapy with aspirin 81 to 325 mg daily or clopidogrel 75 milligrams daily, smoking cessation if currently smoking, and lifestyle modifications including heart-healthy Mediterranean diet and regular aerobic exercise. Additionally, physical therapy focusing on gait training with visual and auditory cues, balance exercises emphasizing weight shifting and reactive balance responses, strength training for legs and core, and fall prevention strategies including home safety evaluation and assisted devices can improve function and reduce fall risk, even when underlying brain damage cannot be reversed. Warning sign number 3, urinary urgency, frequency requiring bathroom trips every hour, and embarrassing incontinence episodes. Warning sign number 3 surprises most people because urinary problems seem completely unrelated to stroke or brain disease. Yet urinary urgency, urinary frequency requiring bathroom trips every hour or even more often, nocturia waking you from sleep multiple times nightly to urinate, and urge incontinence where you experience sudden overwhelming urge to urinate and cannot reach the bathroom in time, resulting in embarrassing accidents, are extremely common symptoms of lacunar stroke disease affecting specific brain regions and white matter tracts controlling bladder function. The mechanism involves lacunar infarcts and white matter disease affecting frontal lobe regions and their connections through white matter tracts to subcortical structures and brain stem centers, regulating bladder storage and emptying. The brain normally exerts inhibitory control over bladder contractions, allowing you to suppress the urge to urinate and delay emptying until reaching a bathroom at a socially appropriate time. This voluntary control requires intact frontal lobe function and intact white matter connections between frontal cortex and subcortical bladder control centers. When lacunar strokes damage these inhibitory pathways, voluntary bladder control is lost. The bladder becomes hyperactive or overactive, contracting with minimal filling volumes as small as 50 to 100 milliliters instead of the normal 300 to 400 milliliters. This causes urgent frequent need to urinate. When bladder contractions occur, they're uninhibited and strong, sometimes causing involuntary urine leakage before you can reach a bathroom. Research from the Journal of the American Geriatric Society examined urinary symptoms in older adults with cerebrovascular disease. Studies found that patients with extensive lacunar strokes on brain MRI had 2 to 3 times higher rates of urinary urgency frequency exceeding 8 voids daily, nocturia waking them 3 or more times nightly, and urge incontinence episodes compared to age. Matched controls without lacunar strokes on imaging. The severity of urinary symptoms correlated directly with the total burden of white matter disease and number of lacunar infarcts, not with bladder muscle function, prostate size, or pelvic floor Strength. Warning sign number 2, progressive memory problems, difficulty concentrating, and personality changes that family notices. Warning sign number 2 is progressive cognitive decline and personality changes from accumulating lacunar strokes causing vascular dementia or vascular cognitive impairment. Unlike Alzheimer's disease, where memory loss for recent events is typically the predominant and earliest symptom, vascular dementia from lacunar stroke disease typically presents with slowed information processing speed, difficulty with executive functions like planning and completing complex multi-step activities, impaired attention and concentration, making it hard to focus on tasks. Follow conversations and personality changes including apathy, social withdrawal, and depression. Early signs include noticing that thinking feels slower and more effortful than before. Tasks requiring mental effort become increasingly difficult and frustrating. Planning and completing complex, multi-step activities like preparing meals, managing medications, or handling finances becomes problematic. You need more time to process information and formulate responses to questions. You lose your train of thought mid-conversation. Multitasking becomes impossible. Family members notice you seem less engaged, less interested in hobbies and activities you previously enjoyed, more withdrawn socially, and more emotionally flat or apathetic. The mechanism involves accumulating damage to subcortical white matter and deep gray matter structures from repeated lacunar strokes. White matter contains millions of nerve fiber tracts connecting different brain regions and allowing them to communicate and work together as coordinated networks. When white matter is progressively damaged by multiple small strokes, these connections are severed. Different brain regions become functionally disconnected and cannot communicate efficiently. The result is slowed information processing as signals take longer to travel through damaged pathways, impaired executive functions requiring coordination between frontal lobes and other brain regions, and difficulty with attention and concentration. Research from the journal Neurology examined cognitive patterns distinguishing vascular dementia from Alzheimer's disease. Studies found that vascular dementia patients showed relatively preserved memory for past events in early disease stages, but significant impairment in attention, processing speed, and executive functions. They performed poorly on tasks requiring rapid information processing, mental flexibility, and planning, but could recall autobiographical memories reasonably well. Brain imaging showed extensive white matter hyperintensities and multiple lacunar infarcts rather than the cortical atrophy characteristic of Alzheimer's disease. Importantly, vascular cognitive impairment often shows step-wise progression where function declines suddenly following each new stroke, then plateaus until the next stroke, contrasting with gradual steady decline typical of Alzheimer's disease. Patients and families may notice sudden worsening of memory or other cognitive functions after each new silent stroke. Warning sign number 1, brief episodes of confusion, disorientation, difficulty understanding surroundings, or feeling mentally foggy lasting minutes. The number 1 most sensitive early warning sign of developing lacunar stroke disease and the symptom most likely to appear before any other symptom is brief transient episodes of confusion, disorientation to time or place, difficulty understanding what's happening around you, or feeling mentally foggy or clouded. These episodes last minutes to an hour, then resolve completely, leaving no lasting effects. Because they're brief and completely reversible, they're easily dismissed as momentary lapses, senior moments, effects of poor sleep or stress, or simply normal aging, related forgetfulness. These episodes are transient ischemic attacks affecting thalamic regions involved in consciousness and arousal, the reticular activating system in the brainstem, or cortical regions involved in orientation and awareness. During the episode, blood flow to these critical regions temporarily drops below the threshold needed for normal brain function. Confusion and disorientation result. When blood flow improves, normal function returns, but the episode is a critical warning signal that cerebrovascular disease is present and progressive, that small penetrating arteries are critically narrowed, and that permanent stroke is imminent without intervention. What you absolutely must do if experiencing any episode of confusion, disorientation, or mental fogginess, even brief and even if it seems insignificant, is seek immediate medical evaluation. Transient confusion may be the only warning before major disabling stroke. Emergency evaluation includes brain imaging with MRI and vascular imaging to evaluate arteries. Immediate initiation of preventative therapies including antiplatelet or anticoagulation medications, blood pressure management, and statin therapy can prevent the impending stroke. These 7 warning signs indicate Lacunar stroke disease is damaging your brain. Foot pain, abdominal pain, weakness, walking difficulty, urinary symptoms, cognitive changes, and confusion all demand evaluation. Early diagnosis and treatment prevent vascular dementia and disability. Which symptoms surprised you most? Share in comments. If this saves lives, please share. Subscribe for neurological health content. Thanks for watching.